All right, we're back. Thanks again to Vicki Lawrence for joining us. Our next guests are actually two folks. We've got Dr. Kier Huehnergarth, the cardiologist from the Polyclinic, and Ironheart founder David Watkins. We're talking about cardiac patients who can regain a very healthy lifestyle through athletics. Here's Shannon O'Kelly, Dr. Huehnergarth, and Dave Watkins.
Dr. Huehnergarth, welcome. Good to see you again.
Nice to see you again, too.
And Dave, welcome to you.
Good morning.
Good morning, and we're going to talk about Ironheart Foundation. And Dave, talk about Ironheart and what that is, and we're going to chat about it.
Yeah, so Ironheart Foundation's been around about 13 years, started here in Seattle. We're now in 20 countries, 49 states. Really, our objective is to provide a positive outlet for all of those that have been impacted by heart disease. And we do that through sport.
Let's talk about that. I mean, you're talking about heart patients participating in sports, which is something that most people think that can't happen.
Exactly.
I mean, Dr. Huehnergarth, as a cardiologist, why don't you tell us how it can happen? And then, Dave, I'd like to talk to you. Obviously, you have a personal experience here that we probably should get into because you started this. But Dr. Huehnergarth, I mean, as a cardiologist, if you're a heart patient and you have a heart condition, most people think I got to sit down and read the paper.
Yeah, it's a fascinating and really important issue. Actually, Dave and I just returned from an entire weekend conference called Care of the Athletic Heart that's put on by the American College of Cardiology. And really, the goal is understanding how we can safely get folks who have heart disease or have risk factors for heart disease out being active, doing things that are A, good for the heart, and B, good for the mind. And so it's an area of a lot of research and trying to understand how we can safely do this, because in the grand scheme of things, it's good for people as long as we can get them out there doing it safely.
So real quick, let's talk why it's important for people with maybe chronic heart conditions or heart conditions to exercise. Why is that good for the heart, and why is it good for the mind and these people?
Sure. Yeah. So in the big picture, if you look at folks who exercise compared to those who don't, even folks who have heart disease, and of course there are variations on this, the risk of having a heart problem if you're consistently exercising is lower than if you don't. I mean, that doesn't come as a surprise, but it reduces things like blood pressure, it reduces things like cholesterol, it reduces the risk of diabetes, and all of that culminates in reducing the risk of heart disease. And in terms of the mind, gosh, every time you look at it in every different way, exercise is beneficial to the body.
So exercise, for our listeners, the reason it's important is because when you exercise, you're taxing your heart. Your heart has to increase its pumping beats per minute. It has to increase the volume of blood that it's pushing out into the body, and that increased blood flow to the brain, for example, with mental health and exercise. The better blood to the brain, the healthier the brain is. I mean, essentially, that's kind of in a nutshell.
Yep, agreed. And the body really has to adapt to the exercise that you're doing. The muscles have to adapt and prepare itself for the next exercise. So you're basically taxing the body in a way that it trains it to get better and stronger.
And this exercise, Dr. Huehnergarth, it does not have to be something that you're going out and doing an Ironman or running a half marathon. I mean, you're talking about, what is it, a recommended 30 minutes of some aerobic activity daily, which can you kind of define that a little bit for our listeners?
Sure, absolutely. Yeah, and it is true. It doesn't need to be an Ironman or a marathon. In fact, there are some interesting studies that show that maybe that doesn't need to be the goal for somebody if it's for health in particular. So the recommendations, if you look at what the American Heart Association has to say, it's 5 days a week, 30 minutes or more a day of moderate exercise. So, and more than that is great. And adding some strength training or resistance training in there is great as well. But exercise can be walking out, walking your dog, just being active.
And so we're going to get Dave on because I know Dave's got a really neat story. But right now, just to wrap up our first segment here, I'd like you to talk about, how do I know I'm doing on moderate exercise? If I'm starting to exercise, how do I know I'm moderately exercising?
So I like to use the term rate of perceived exertion, which is, we all know how it feels when you get out and you get your heart rate going and you're huffing and puffing a little bit and sweating. If you're doing that, you're getting the exercise.
We continue our conversation with Dr. Kier Huehnergarth, David Watkins from Ironheart Foundation, talking about how you can regain a healthy lifestyle, even if you've been a cardiac patient, to athletics. That conversation continues right after this timeout on KOMO.
Dave, thank you for standing by patiently, and I wanted to bring you on because you have a really neat story. So tell us about your personal experience with your heart and your exercise, and then just how you became the founder of Ironheart.
Always been active, played football and baseball through college. Met my wife, who was a runner, and she looked at me and said, we need to change the way you think about what being in shape means. So she got me running. I got hooked. That led into some triathlons, and I ended up doing a race here locally in Seattle and collapsed at the finish line. That brought me in to see my doc, who got me over to cardiology, and I found out I was all sorts of a mess inside. Eventually, that led to needing surgery. For me, it wasn't something that was acquired. This was something that I was born with that I just never knew that I had. So as I was going into surgery, I remember really asking myself, what's your legacy? How are you going to, be remembered by your kids? And I didn't really have those answers. And when I got out of this very complicated surgery, the only way I really knew how to do that was through sport. And so I decided to take on the most extreme thing that I could, really as a metaphor, to teach my kids some life lessons, and that was the Ironman triathlon.
Wow, interesting. So just so our listeners really understand and appreciate this, Dave was a collegiate athlete, very active, had no symptoms, through high school physicals, through college physicals, and then all of a sudden, as an adult, you're running a race, and you collapsed at the finish line, and you had a congenital heart defect situation that was not diagnosed.
Yeah, something, that 1 in 100 have a congenital heart defect. It was just my turn to learn at that point that I was one of them.
So Dave, when you were going through these high school physicals and collegiate physicals to participate, they never said you had a murmur? They did not detect a murmur at all with your valve issue?
No, for me, I was cleared really until the end.
Wow.
And I think typically a murmur is something that might be found early on, but for me, no.
Well, yeah, you're right. You're exactly right. It can be, but in today's world, a murmur has to be followed up on because in my day as a high school, we would have kids that had murmurs, and the doctor would say, "Don't worry about it. Now they need to be followed up on." I think that's the cardinal rule. Tell us about Ironheart Foundation.
Yeah, so Ironheart Foundation, now we're a virtual nonprofit organization all over the globe. And what we really do is provide a positive outlet for cardiac patients that want to have active lifestyles. In many cases, we refer them to doctors that specialize in treating active people, cardiologists that specialize in treating active people. We are getting into research, and we are also providing scholarship for folks that have been impacted by heart disease that use active lifestyles as a way to improve their lives and now want to use academics as a way to improve their lives as well.
Well, Dave, that is great, and that's awesome. So, a take-home message to your listeners is if you have a heart situation or have had heart disease or been diagnosed or had surgery, you don't have to give up.
Never give up.
How could our listeners get more information on the Ironheart Foundation?
So it's pretty easy. The simplest way is to go to ironheartfoundation.org.
Thank you so much for your time. Great information. We'll have to have you come back, and Dr. Huehnergarth and any other topics that our listeners might enjoy.
We'd love to.
Great. Appreciate being here. Thank you.
Well, that's a great conversation showing that you don't have to curtail your lifestyle if you have been a cardiac patient. Thanks to the founder of Ironheart, David Watkins, Dr. Kier Huehnergarth, the cardiologist from the Polyclinic. And you can get more information at ironheartfoundation.org or polyclinic.com. Back to wrap things up right after this time out on KOMO.